Really are astounding. Daily cases down 75% since mid-April, down 90% since January's peak. Can we all but declare the pandemic over, at least here in the United States?
Well, I think we can declare that we're going to have a very good summer and prevalence is going to be very low. I think as we get into probably the late fall, more likely the winter, coronavirus is going to start to circulate again. And we could face outbreaks of it in select cities, particularly where vaccination rates are lower, and particularly if we get a mutation where we have new variants that pierce prior immunity, the immunity acquired through prior infection, and also pierce the vaccines or partially pierce the vaccines. But I think this summer prevalence is going to be very low. We're not going to be reporting a lot of cases. We'll probably get to about 10,000 cases a day. I don't know that we'll get much below that because we're doing so much testing around the country, and there will be sporadic outbreaks in summer camps and the like. But the thing to watch also is hospitalizations. Hospitalizations are declining sharply. They're a lagging indicator, so they reflect what was going on maybe 3 weeks ago. But we're going to see those continue to come down because the bottom line is we're getting a lot of protective immunity in the most vulnerable Americans. So the consequences of the coronavirus cases that are occurring in the United States aren't as severe because they're occurring in people who might be younger, healthier, because more of the vulnerable Americans, people who would have a bad outcome, are now vaccinated.
Well, how concerned are you about one of these variants, in the word you used, piercing the vaccine? I'm looking here, this Indian variant, which they're now calling Delta, by the way, is now in 62 countries, and there are hotspots popping up in Africa and Asia. So how worried are you?
Well, right now, we've seen a number of variants, right? We saw the 1351 in South Africa. We saw P1 in Brazil, the 617 in India. We've now seen this new variant in Vietnam. So far, none of the variants that we've seen have completely defeated the vaccine. So we haven't had a situation like we sometimes have with the flu season where you get a new strain of flu and we find that the vaccine is largely ineffective against that variant that's circulating. We have seen cases where some of these new variants seem to have, the vaccines seem to have diminished effectiveness against some of these new variants, but with experimental evidence. But even in those cases, the vaccines seem to be about 75, maybe 80% effective against the variants, you know, down from the 95% that they were against the original Wuhan strain, but still very effective enough that if enough people are vaccinated in a population, you're not going to have large-scale transmission of these new variants. So we haven't seen a circumstance arise. That doesn't mean it can't happen. And also what happens in virology sometimes is that you get a new variant that combines mutations from different variants, and you get a very different virus. So sometimes 1 + 1 doesn't equal 2. You might take the mutation that's found in one variant and the mutation that's found in another variant, and in isolation, those mutations don't really cause the virus to behave much differently. But then when you combine them, the virus behaves very differently. So there's always a potential for that. We haven't seen it yet, which is a good sign that maybe we won't see it. We're unlikely to lose the vaccine entirely, perhaps just see diminished effectiveness against a new variant that might emerge.
But what has to happen for you to come on the program and have me ask you that question, is the pandemic now over? And you say, yes, it is.
Look, I think we're in a very good situation here in the United States. You don't know what you don't know. And as we get into the winter, coronavirus is going to circulate. It's a late winter pathogen. There are going to be people who are unvaccinated. There's people who are, have immunity from prior infection. That's going to start to wear off. They'll get reinfected. So this will circulate. I think there's going to be very low prevalence this summer. I don't think we're going to have an epidemic next winter. Certainly nothing on the scale of what we've suffered this past year. But you will have circulation of the virus. I wouldn't want to declare, mission accomplished. But I think this is a near-term victory. We should celebrate it. We should try to lock it in by getting more people vaccinated. And as we return into fall and the winter, we'll probably have to implement some respiratory precautions in workplace settings and schools, but nothing on the order of what we've experienced now. We're not going to have to shut down business and commercial activity. We'll be able to live with coronavirus circulating in the background. Hopefully it won't affect the most vulnerable Americans because they'll be vaccinated. We're also going to face flu this winter, and we're likely to have a worse flu epidemic because we didn't have flu circulate for a whole year. So we haven't put immunity into the population in a year. So there is a potential that if you get a flu strain where there's a mismatch, a partial mismatch between the strain that circulates and the flu vaccine, you could have a pretty bad flu season. So that's something that we're worried about as well.
Well, speaking of flu, what about this new reported human case of bird flu over in China? How concerned are you about that?
Not that concerned right now. We don't know a lot about it, but based on the reports that have been published, it doesn't seem to be a very pathogenic strain, at least not in the chickens. That doesn't mean that it wouldn't behave differently in humans, but it doesn't seem to be a very deadly strain. This was the first case where it jumped from poultry to humans, but there's a lot of other flu strains that we see jump from poultry to humans from time to time, and other bird viruses, other bird influenzas that are much more pathogenic than this strain appears to be. So there's a lot of danger out there that we could have the circulation of a novel strain of influenza, and we were long overdue for a pandemic with flu. So I think we need to remain vigilant and look at ways to try to improve our preparedness generally. We need to start looking at public health preparedness through the lens of national security, because what this epidemic showed us, what this pandemic showed us, is that this was an asymmetric risk to the United States. This hurt the U.S. and hurt Western democracies much more than it hurt other countries because we had difficulty implementing respiratory precautions. So we need to look at this differently through a different lens now and involve our tools of national security in trying to mitigate these risks.